When it comes to dark spot treatments, there are so many options out there that it can be hard to know where to start. What ingredients should you look for? And most importantly, which ones will get rid of dark spots for good? What causes dark spots? Dark spots or hyperpigmentation are due to the overproduction of melanin in the skin by melanocytes, plastic surgeon Melissa Doft, MD tells Self. This extra melanin can be triggered by a lot of different things. Hormones, both estrogen and progesterone, can increase the level of melanin, why pregnant women see dark spots that often lighten following birth. The sun can increase the level of melanin, why we have more dark spots after the summer, and age can increase the size of the melanocytes, why we see dark age spots in older patients, Dr. Doft says. Other factors, like skin irritation as a result of acne, waxing, and harsh scrubs, can also cause dark spots. 1. Vitamin C. Think beyond orange juice. Vitamin C can be used as a topical antioxidant that helps to block free radicals from causing oxidative damage to the skin, which can lead to wrinkles and a dull complexion, among other things. It also inhibits enzymatic processes that produce melanin in the skin, as such it can help to reduce dark coloration of the skin, Samaya Jamal, MD, of Schweiger Dermatology Group tells Self. Another added benefit is that vitamin C only lightens targets problem pigmentation areas, not the rest of your skin. Fran E. Cook-Bolden, MD, dermatologist, cosmetic surgeon, and director of skin specialty dermatology tells Self. How to use it: massage a few drops daily onto cleansed skin, preferably before applying sunscreen in the AM. 2. Hydroquinone. When it comes to dark spot treatments, hydroquinone has been the gold standard for over 50 years. You can find this ingredient over the counter in concentrations of 2% or less, whereas the prescription has 4% or greater. On a biological level, hydroquinone works by inhibiting an enzyme called tyrosinase, which aids in the production of melanin, Dr. Cook-Bolden says. Naturally, the less tyrosinase produced, the less melanin produced. In some cases, the effects of hydroquinone can be seen in as little as 2 weeks. However, most should anticipate 8 to 12 weeks of use to see a visible difference depending on a few factors, such as the extent of the hyperpigmentation, how deeply it penetrates, how long it's been there, etc. As with any product that is applied to the skin, hydroquinone can cause dryness, redness, and burning, which may signal an allergic reaction to the ingredient, cautions Dr. Cook-Bolden, who always recommends trying a spot test first. Another potential side effect is ghosting, which is the inadvertent lightening of the skin outside of the targeted area. To avoid this, apply hydroquinone sparingly to the center of your spot and feather toward the edges. How to use it: best applied at night to start, and eventually increased to twice daily for maximum effects. During the day, pair with sunscreen as the ingredient can cause sun sensitivity. 5. Azelaic acid. This lesser-known ingredient is a dermatologist-recommended treatment for dark spots on the face. So, what is it exactly? Azelaic acid is a naturally occurring extract from oat, wheat, or rye that interferes with production of abnormal pigmentation, Dr. Zeichner explains. Bonus, it has antibacterial properties that can help banish acne and the scars pimples leave behind. How to use it: apply it all over your face once or twice a day. You can use it alone or with your favorite moisturizer. When using it during the day, be sure to follow it with sunscreen. 6. Lasers. Lasers are the most expensive, yet most impactful treatment to reduce dark spots. These use a focused beam of light that has a specific target or chromophore pigment to break up and eliminate the pigment particles in the skin, Dr. Cook-Bolden says. IPL, intense pulsed light, can treat unwanted pigmentation. However, it delivers less focused light and may have an unwanted effect on the surrounding skin, especially in darker or tanned skin. The ideal laser treatment for hyperpigmentation will provide a cooling blast, or at least limit the amount of heat generated. Ask your dermatologist or laser technician if the laser they're using treats at a rapid rate with a focused beam, like the Lightpod Neo laser by Aerolaser. This type of laser will help avoid an inflammatory response, burns, or collateral damage, Dr. Cook-Bolden says. Cost: $250 to $2,500. Derm tip: anticipate as many as 6 treatments, possibly even more, with 3 to 4 weeks in between, in office only. 7. Chemical peels. Exfoliating treatments like chemical peels remove the upper layers of dead skin, helping to reduce the dull appearance of the skin so that it reflects light better and appears to glow, Dr. Jamal says. Over time, these treatments can stimulate collagen production, enhance cellular turnover, and reduce the appearance of dark spots, he says, but beware a chemical peel that is too powerful, which can burn the skin. Common active ingredients in pro-grade peels include glycolic, mandelic, salicylic, and lactic acids, along with trichloroacetic acid. While at-home peels are available, they are more likely to slough off dead skin rather than get deep enough to lighten dark spots, Dr. Jamal adds. Of course, keep in mind that chemical peels can be harsh, particularly on sensitive skin, so be sure to talk to your dermatologist about how you may react before booking one. Cost: $100 to $1,000. Derm tip: typically 3 to 6 treatments, possibly more, spaced out by 3 to 4 weeks is needed to see results. Note: deeper peels have greater risks but may only require 1 or 2 treatments. 8. Microdermabrasion. Microdermabrasion is another well-known exfoliating treatment for hyperpigmentation that uses tiny particles to sand away dead skin. Cook-Bolden describes microdermabrasion as a non-chemical procedure that's non-ablative, which means it does not destroy skin tissue, and therefore does not require significant recovery time. Microdermabrasion is best for milder hyperpigmentation conditions, since the results are modest in terms of improving the appearance of skin discoloration. Cost: $100 to $600. Derm tip: usually dermatologists recommend 3 to 6 treatments, possibly more, spaced out by 2 to 4 weeks. 9. Microneedling. Consider this a treatment not for the faint of heart. Performed using a medical-grade, stainless steel roller covered with hundreds of tiny spikes, the tool creates a series of micro-injuries in effort to rebuild the skin collagen production along with elasticity. While many at-home versions exist, Dr. Doft recommends having your physician control the level of penetration, think 0.5 mm to 2.5 mm. For best results, microneedling is often combined with topical treatments. Once the skin barrier is opened, it is also possible to infuse ingredients known to lighten the skin like vitamin C, says Doft. Dermatologists might also use a wound healing serum, or a hyaluronic acid vitamin C compound to help with hyperpigmentation, especially in darker skin tones. She does note there is a potential risk of scarring from microneedling services if they are performed too aggressively. Darker skin patients may also find that they become more pigmented, she adds. But, when done correctly, you will see a brighter complexion by the next week after treatment. Cost: $300 to $1,750. Derm tip: expect to do 3 treatments, possibly more, every 6 weeks with a dermatologist. At the end of the day, prevention, with sunscreen, is key. The good news is preventing dark spots is often as simple as wearing sunscreen, which you're already using every day, right? Daily sunscreen is the absolute best way to prevent hyperpigmentation. Dr. Zeichner says. Even low levels of UV light exposure add up over a lifetime and can cause dark spots. Alan J. Parks, MD, board-certified dermatologist and founder of Derm Warehouse agrees, dark spots will get darker with sun exposure, he tells Self. Sunscreens, and particularly physical sunblocks that have either zinc oxide or titanium dioxide, can block out most of the rays that will darken the dark spots.